Hello everyone, today we're talking about ADHD, attention deficit hyperactivity disorder. So what we know about that? ADHD is evolving toward a more organic conception and a more developmental perspective, moving away from being included as a part of behavioral disorders to being classified within neurodevelopmental disorders, together with intellectual disabilities, autism spectrum disorder, and motor and learning and communication disorders. The age of onset for early symptoms has been expanded from before age 7 to before age 12. Despite cultural differences, the prevalence of ADHD is quite similar across the different countries, standing at around 5.2% of the school-age population. That means that it is very likely that we will find at least one child in the classroom with ADHD. Regarding the etiology of this disorder, studies comparing subjects with and without ADHD under control conditions are especially significant, such as complex studies conducted with twins who were adopted and raised by their biological parents. These studies point to a predominantly polygenic etiology, with a heritability index for ADHD of around 60-70%. Thus, it is estimated that ADHD is 5-7 times more common in siblings compared to non-siblings, has a concordance rate of 50-80% among monozygotic twins, and about 30% among dizygotic twins. It has even been stated that the children of a parent with ADHD have a 50% chance of experiencing the same difficulties. On the other hand, a significant number of scientifically controlled studies also demonstrate the existence of structural and functional brain differences between people with and without ADHD. For example, some studies link ADHD to differences in the prefrontal cortex related to executive functioning, the basal ganglia associated with the inhibition of automatic responses, facilitating or hindering reflection, and or the cerebellar vermis, which has been linked to a motor coordination and an internal timing system for functions that require this type of adjustment. More recent studies in molecular genetics point to the involvement of certain genes related to neurotransmission in the dopaminergic system, which is associated with effectiveness of pharmacological treatments. So there are different criteria for diagnosing of ADHD following APA, American Psychiatric Association, in DSM-5, a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development, characterized by a minimum of 6 symptoms, 5 if the individual is older than 17, from the 9 symptoms of inattention and or the 9 of hyperactivity and impulsivity. Symptoms persist for at least 6 months. They're inconsistent with developmental level. Some symptoms present before age 12. Several symptoms present in 2 or more settings, and the symptoms interfere with social, academic, and occupational functioning, or reduce their quality. There must be a persistent pattern of hyperactivity impulsivity that interferes with functioning or development, characterized by a minimum of 6 symptoms, 5 for ages 17 and older, present for at least 6 months to a degree that is inconsistent with developmental level and that directly impacts social and academic occupational activities, and that is not better explained by oppositional behavior, hostility, or failure to understand instructions. How do we treat ADHD? Of course, we implement behavioral training programs. Cognitive behavioral therapy is an initial therapy for people with this disorder. Also, cognitive behavioral therapy works just fine for this type of problems. But obviously, not everyone's gonna have ADHD. I think this is one of my most common and popular demands when people come to me at the consultation. So we are done. But if you think you might have it, you still can contact me via DM on Instagram and we will find this out. Now, is medication effective in treating ADHD? Let me know what you guys think. Let me know in the comments. And then let's compare results. So, of course, it is effective. Using psychostimulants such as methylphenidate provide direct and immediate result in at least of 70% of cases. Why? It improves alertness, helps to maintain focused attention, it reduces fatigue during prolonged tasks, improves task performance by having a positive effect on a working memory, reduces cognitive and behavioral impulsivity. Medication does not fix the system, but it achieves the level of activation needed for prolonged tasks. It helps for brain functioning, reduces the fatigue caused by tasks that prolongs. This medication is not the magical pill that some people expect. It is still a drug that must be prescribed by a therapist. It improves the conditions under which you study, but it doesn't make you pass the test. Does not teach the strategies, nor does not help how to make friends if they didn't know that before, nor does it make behavioral problems disappear. What can help us in managing ADHD? So self-instruction, self-guidance, training in self-evaluation techniques, self-monitoring, training in exploration strategies, role-playing, self-reinforcement, self-castigation, self-punishment, response cost, timeout, and etc. Check for more tips on my Instagram. If you're trying to complete some task, make some self-reinforcement. So let's just say, for instance, for reading each 10 pages, you earn 1 sticker. And when you have 5-10 stickers, you can allow yourself to go to the shopping, for instance. It works just fine with the kids as well, but maybe not shopping, maybe buying a new toy or something. So you can actually put the stickers on the fridge or the place where you can see it, and that's how the kid can see, and that's how you can manage that. Same as for adult. That was it for today. Don't forget to subscribe for my socials, leave your comment down below, and see you next time. Bye bye.